little bit, okay?
Oh.
There you go. You were sinking down into the bed.
I was really struggling a bit to get my mother to the doctor and to care for her when I got home. And it was getting her out of the bed, into a wheelchair, to the top of the platform, into a chair lift, into another wheelchair, out of the house, down the ramp, down the sidewalk, into the car, which was not just exhausting for us, but particularly exhausting for her.
So our MedStar House Call program in DC serves 8 zip codes in Washington, DC, and we care for older adults who have serious illness and kind of struggle to get out of the home to get to the doctor's office.
So having a medical team come to your home, it's just, it's like a breath of fresh air.
We also serve their family caregivers who are really worried about their loved ones and need medical care at home.
Dr. DeYoung came to the house and he met with my mother, as did her nurse practitioner, Nancy. And they said that she was indeed a candidate, given her health issues and her not being ambulatory.
It allows patients to avoid ER and hospital visits, because if somebody has an urgent condition, they call the office.
Essentially, we are here for you 24/7.
You call, somebody calls you back, and it's usually within the same day.
Typically in a primary care office visit, you have 15 to 30 minutes to see an elderly person. And here we have up to an hour sometimes. So we really don't feel rushed. The patient doesn't feel rushed.
So that population needs a team approach. And our house call team in DC has doctors who are specialized in geriatrics, nurse practitioners, social workers, a nurse, coordinators, and a manager. They need a whole team to care for them at home.
We have new office space, which has been wonderful. We're allowed to have our meetings all together. Our job doing house calls is a little isolating, so it's really great that we can all be together in one space. This is all made possible by the philanthropic gifts.
My philanthropic gift to the program is just one way of showing my support for the incredible job that they were able to achieve.
I think it's fair to say that in the 24 years that our geriatrics and house call team has been in existence, we would not have near the impact on the city, our community, the patients and their families without philanthropic support.
We are a family that is trying to provide the best possible care to our patients and their loved ones to ensure that they have the best outcome and quality of life as possible.
That intimate relationship with patients and families that we have is priceless. Kind of why I get up in the morning to kind of come to work. It's probably the highlight of my day when I'm actually just out in the field.
I can never give enough, and I don't think anybody can, because we need to grow the program, and because it makes a huge difference in our community.
I'm an only child. My mother means everything. I think the biggest way it's helped me is simply peace of mind. She gets this full service that otherwise I would not be able to have, and I'd be worried to death about what am I going to do to make sure that I'm doing everything I can to care correctly for her.
That's okay.
Okay.